Hi, I'm Gary White for Channel 6 Central Kentucky Television. I'm here with Dr. Johnny Isaacs with Isaacs & Isaacs General Dentistry on Bob Elling Drive in Springfield for our regular monthly segment on tooth and mouth health, right?
That's
and today we're going to talk a little bit about myths.
Dental myths.
Yeah.
In the dental profession, we're always bombarded with people, especially with the internet now. People can Google things, and there's a lot of information there. There's a lot of misinformation. So some of it, most of it's pretty good. I mean, it's very accurate. But it seems like to me we keep getting the same questions, the same things come up, and people, it's almost like they want to believe the myth because that would be better, and that would be feeding into what their childhood thoughts are. And a lot of times it's not true. So I do want to touch over some of the dental myths.
Okay.
Now, the first one I have written down here is about the dental x-rays. Recently, like within the last month, Dr. Oz came on and was talking about dental x-rays. He specifically said dental x-rays were causing an increase in female, he didn't say male, he just said female thyroid cancer. Now, there's no proof on that. I've done some research. So I think it's inconsistent with scientific teaching to throw something out there like that. It's not being judicious when Dr. Oz, and there's several things he's done about that. One is the silver fillings too. When he throws out just a hunch and everybody takes it, and it's just no truth to it. There's no scientific evidence substantiating that. The amount of radiation that we use now in x-rays, it used to be 40 x-rays, 40 of those little tiny x-rays equal 3 hours out in the sun, which is not much. Now we're using digital, it is 400. So it takes 400 x-rays to equal 3 hours out in the sun. Now nobody would not go out in the sun and sunbathe and do anything. It's just we're out there a lot. So really put on your sunscreen, but it's just not the amount of radiation we're getting is minuscule. And have I ever taken 400 x-rays on any individual? No, never have. Not since I've been doing this are there 400. Have we ever taken 40? Yeah, over many years we've taken 40 on somebody. But now that we're using the digital, 400. So we're never going to approach it. So that's a myth I'd like to kind of put to rest. Now, while we're talking about the silver, it's been recommended by a lot of some dentists and some holistic medical professionals to remove the silver, which in your fillings, which contain mercury. Now, do we advocate putting mercury or the silver fillings in there? Yes, I do. I do it daily because the studies have shown that does not cause a problem. What causes a problem is actually removing them, because you get more vapors if you remove them than leave them in there. But even that's been proven that it's such low figures that that's not a problem either. So do I advocate the mercury, the silver fillings? Yes, I do. I use them in my office. Do we use the composite? Yes, we do. We do that also. We use the plastic fillings too. If they're small enough, they work doing it every day. But if you got a huge filling in there, the amalgam fillings still work very well. So,
And that's the silver.
That's the silver ones. Okay, they still work. We still use them. We're getting we're getting away from using them just because people request it. But we have to be frank with them that the composite fillings don't last as long. Now, you talking about a bonanza? If they were a problem, if everybody came in and we had to replace all those silver fillings, there wouldn't be enough dentists in the world to do that. So, fortunately, they're not a problem. And if you have them in your mouth, leave them. And then if you need a consult, want me to take a look, just come in. I'll give you a free consult. But it's not a problem. Now, some of the other myths we were talking about. There's another myth. A lot of women think that each pregnancy that you have used to be a tooth of pregnancy, and that was just an old wives' tale that people thought that you would lose a tooth if you had a baby. Now, are there certain things? What really happens is, and I noticed this when my wife was having children, that a lot of women get up in the middle of the night and they nurse or they can't sleep. So what do? They take orange juice, they eat that little piece of cake that was laying out after a dessert, and they snack a little bit on that, and that's normal, that's common, but it does promote tooth decay, and tooth decay does eventually will get into the nerve, and then you will have to get a tooth out. So it does increase your chances just because of your lifestyle changes. But does pregnancy zap the calcium in your body? No, it does not take it out of the bones or the teeth. Now the baby is using the calcium in the blood supply, but there's enough there as long as you have good nutrition.
Okay, so some good tips there. Now also there is one with regards to what we drink and whether certain sodas or
well, a
different
lot of
types
people
Vitasource.
switch. Of course, when I was growing up, there was no. I can remember a day when there was not anything called diet drink, and that came out probably in the early '70s or so. Whenever Tab came out, and people started drinking that. People think that it's not harmful to your teeth. It's not as bad as the straight sugar, but it still is acidic, and it still can cause damage to your teeth. I recommend that and now that we've gotten off the tap water, we don't drink tap water anymore. A lot of us drink that bottled water, and that started in the '80s, and then now I still advocate drinking the tap water. The tap water is good. The water supply here is good. We talked about
from the chairman of the water board, Springfield.
So I have to say that, but we discussed that last night at another meeting. So the water is safe and effective, and it's got fluoride in it. It has 1 part per million fluoride in it. So that's been going on here in Springfield since the late '60s. We've had fluoride in the water, and it's a benefit. We've seen a marked decrease in the caries rate nationwide with the counties, and it's a county by county decision to make. I believe maybe the state might do it now, but there's certain counties in the country who still don't have fluoride in the water. So and it's out west somewhere. I think it's in Texas and maybe Nebraska. I'm not really sure. So fluoride.
So that's where dentists need to go.
You think so? But honestly, no. I would hate to go a place where there's no fluoride, because all you're going to be doing is taking teeth out. And if we put in something, the bridge work or something big, it's going to fail because there's not enough fluoride to maintain it. So really, all this nice work that we put in there won't last. So I would hate for somebody not to have fluoride. So it's counterproductive.
Yeah. With regards to that, I remember a myth that I had heard, or it may not be a myth. You can tell me whether it's a myth or not. Is that fluoride in the water is a really good thing. However, after a certain age point for the person, it doesn't really affect their teeth anymore.
No, it still does. It is good while the teeth are growing. It works topically. It will. By that I mean it works when it touches the interface between the teeth and the saliva. It will work there. Now, if you get it systemically, it will get into your bones, which makes the bones a little stronger too. But it will not affect the teeth. The teeth don't grow that way. So the fluoride applications are still good. And as people get older, we're losing. When you lose some of the bone, remember we talked about getting along in the tooth a few times ago. When the gums recede a little bit, what you have is the dentin is exposed, and the dentin is a lot softer than the enamel, and that needs fluoride too to make it strong. So as you get older, you certainly still need the fluoride. Now we don't give it to the adult patients a lot of times, probably because the insurance doesn't cover it. I mean, we're kind of dictated to what we do a lot of times by what the insurances tell us will cover it. So really, we probably ought to be giving more fluoride to the adult population. Probably the over 60, over 70, 80-year-olds that we see probably ought to be getting more fluoride.
Speaking of that, when you go out to buy your toothpaste, you have all these different varieties of whitening, fluoride, mouthwash, clean teeth, all that kind of stuff. Do you have a recommendation as to what's the best thing to add?
Not really. It's a personal preference. I tell people the best thing is elbow grease. Just get in there and actually doing it. If you just get in there and do it, there's no substitute for just water and a toothbrush. Now, the toothpaste that they come out with, there's flavors to it. There is fluoride with it, so I do advocate fluoride. You can overdo brushing your teeth. You can get too abrasive. You can actually wear the teeth down by brushing too much. Now, me being a dentist, it's a nervous habit of mine. So I brush my teeth throughout the day. I don't know how many times I do it. Too much, but I don't put a whole lot of pressure on it. It's just kind of a nervous habit. I'll go to the restroom and, there's my toothbrush and I have at it. So, and my gums are in pretty good shape.
Yeah.
But you can't overdo it. You can't get too abrasive. But don't let that stop you. I keep doing it.
And how often do you change your toothbrush?
You should change it once a month. Now,
A month, okay.
Now, a lot of people won't. They'll do it, and I'm guilty of it too. I do it till it kind of sprays out and looks terrible. And I throw it away. But you should do it once a month. And there's all kinds. It used to be 3 months. I used to hear, but once a month or so. And certainly, a lot of people say, well, I ask them how often they change it, and they say, when you give me a new one. So we always give people a toothbrush when they come in, but you should change it more regularly than that. If you're not, you're probably not using it enough.
Right.
And
Well,
use a soft. Use a soft toothbrush instead
Right.
of a hard.
Yes.
Okay, we've covered that before too.
Yes. Well, there's some great tips from Dr. Johnny Isaacs with Isaacs and Isaacs General Dentistry on Bobolink Drive in Springfield. And if you're looking for an appointment or a place to come, then give Dr. Isaacs a call. What's the phone number?
859-336-7680.
And stay tuned to Channel 6 Central Kentucky Television for some more tips from Dr. Isaacs. It's been Gary White for Channel 6 TV.